And I chose this topic mainly because it's so prevalent in our society. Your handout will give you a brief overview of what we experience when we're treating people who have arthritic problems. Going off this slide, I'll just touch on some of the more important things. As we know, it's extremely prevalent in our society. One form or another affects 66 million Americans, or mainly 1 in 3 of all adults. The arthritis can be particularly troublesome once it hits the foot.
Yes, it can.
As attested. So, just a couple other facts. We can sometimes be the first ones to diagnose this problem because of the number of joints in the feet. So one of the questions I used to get when we were in podiatry school is how many bones are in the foot? So the right answer is 26, but you better say 28, because there's 2 little bones on the bottom of the first toe joint that routinely are in 90% of Americans, but they're not in 10%. So the correct answer is 26, which means all of that, there's at least 13 joints that make up the foot. Then you add the 2 little ones, that's 28, so now you got 14 joints. So you have all these joints in the foot because of the bones that are prevalent in our feet. You can get arthritis in the toes. You can get arthritis in the ball of the foot. You can get arthritis in the midfoot. You can get arthritis in the heel. And that's why we can sometimes be the first doctors to diagnose this.
Do you see that in an x-ray?
Oh yeah, that's...
Like where it is?
Yes, and you know, it's funny because you have to have that x-ray. You have to have an x-ray of the feet to be able to say, okay, Mrs. Jones, you've got arthritis. You have to have the x-ray because that's the only way to determine it. There's another wonderful test called a CT scan that will usually be able to help us with advanced arthritis. But the screening test is an x-ray. So it's one of the most prevalent chronic conditions in the nation. It's second only to heart disease, and it can limit your activities, as you can attest to.
Yeah, tell me, I know.
So, this is interesting. Take a look at this one. Cost to the U.S. economy more than $86.2 billion annually with arthritis. And think about it. Think about everything you have to do for arthritis. You've got inflammation of a joint, which is breaking the word down. That's exactly what it means. Arthritis is inflammation of the joint. And so the first thing you think about is all the Advil you're buying. And then all the ibuprofen and all the Aleve and all of the medication. So that's just the over-the-counter stuff. That does not include the prescription strength medications that most of these people are taking. And it can affect all age groups, and the baby boomers are like prime example, because now they're all retiring, and that's when they are going to see the arthritis the most. This is the Webster's Dictionary. Arthritis is inflammation and swelling of the cartilage and lining of the joints, and generally accompanied by an increase in fluid in the joints. And that's something to be kept in mind. I'm going to talk on that a little bit later. Often arthritis is a component of the complex diseases that may involve more than 100 identifiable disorders. What does that mean? That means that it could also be a secondary problem to something more serious. Okay? So it can be primary, happening on its own, secondary, happening with another disease process.
Is there anything you can do for inflammation?
Well, yes, there's a lot of things.
Can you take anything for it?
Huh?
Can you take anything?
Sure. Advil, Aleve, and I'm going to get into some of the treatments for this. This one I want you to touch on this one here, because this is the one that we deal with a lot, most prevalent in the office, and that is from degenerative joint disease. You're just wearing those joints down, and they're getting worn down because of all of your athletic endeavors when you're in your teenage years and your young adult years. And now you can see also bacterial in conjunction with inflammatory bowel diseases and also with autoimmune. And who can tell me what's the most common autoimmune arthritis? Anybody?
Psoriatic.
That's one. That's not the most common. Rheumatoid. Rheumatoid, number one. Psoriatic, that was a good guess. Psoriatic is very, very, very prevalent, as you can see with the commercial by filmicillin. Osteoarthritis is the most common form of arthritis, and that's the one I was just talking about. That's your wear and tear arthritis. That's the one that happens when you break down that joint, that cartilage lining that gets damaged, the cartilage starts to peel, the cartilage starts to flake off, and it happens because of wear and tear. It's often caused the wear and tear arthritis, degenerative arthritis. It's gradual, it's the aging process that breaks down the cartilage. And here it is. This is what we hear. Doc, my foot hurts, it's throbbing, it hurts at night, it hurts when I'm active, it hurts when I'm in a tight shoe, or it hurts when I get off my feet are burning. So these are the things we begin to see once you start developing arthritis in the foot. And here's a good one. This is one I want to touch on a little bit, particularly seen in feet when patients are overweight. And it's due to the deterioration of cartilage and development of bone spurs. Weight is not going to be a causative agent as much as it's going to be a much more, it's going to be an aggravating agent, okay? There's an old saying, 1 pound of weight adds 7 pounds onto your joint.
Wow. Wow.
So it can really be an aggravating agent. 1 pound. So it's extremely important that people who have arthritis stay active, because if they're not, the added weight will make matters worse. So it's one of our goals in treatment to try and keep everybody continuing to be active. As you can see, the top one, rheumatoid arthritis, it's the most crippling. And rheumatoid arthritis is usually first heard when we see people in the office, hands, toes of the feet. Now think of it, rheumatoid is a systemic arthritis. It happens throughout the body because it's your body attacking itself. Your body is actually saying, okay, it doesn't know that its joints are part of the body. It's like, well, it'll go into the smaller joints, and it happens equally in both sides. So you're rarely going to get, my big toe hurts. One big toe? No, not with rheumatoid arthritis. My hands hurt, my toes hurt, my neck hurts. That's the complaint for rheumatoid arthritis. It's a generalized overall body complaint. This is a little bit redundant. Types of rheumatoid arthritis. It's more acute onset than osteoarthritis. Intermittent periods of remission, exacerbation, results in joint deformity and loss of motion. Rheumatoid arthritis actually eats the joint away. It actually literally eats the joint away. To go back to a game in the 80s, Pac-Man comes to example. It literally looks like it's getting eaten away. And it happens mainly in the metacarpal joints and in the metatarsal joints. That's where you're going to start to see these rheumatoid changes. It's extremely invasive and extremely destructive. This one is important. All right, so I get a call on the phone. My foot's killing me. Well, how painful is it? Well, I can't even put a sheet on it. Okay? What'd you do to it? I didn't do anything to my foot. So lack of trauma, acute flare-up of pain, and it's called gout, gouty arthritis. Now, does anybody know what causes or triggers gout? Anybody? Dietary. It's dietary, and it's a buildup of uric acid, correct. But most of the time, that uric acid is coming from protein breakdown. So what will happen is, it used to be called rich man's disease. So in the books, you've got the kings with the big old chicken leg or turkey leg in one, you got the beer in the other, and he's got his foot up on the chair and it's killing him. And it's because of the protein breakdown. And the protein breakdown goes from protein to uric acid. And it's because of the amino acid breakdown into purines. I'm not going to get too detailed. All I'm telling you is that the uric acid is because it breaks down from amino acids, which is the building block of proteins. So when you're binging on these turkey legs and sausage, and it's usually a dietary cause for gout. Yes?
What about protein drinks? Not
That's a good question, and that is definitely one on the top of the list.
really.
Men are far outnumber women until women hit menopause. When women hit menopause, they lose the protective estrogen component, which predisposes them from getting gout usually, and so they'll start to catch up. So most of this is seen in men, but I have seen some nasty cases of gout in women, and that's usually after they've reached menopause. In the great toe joint, it's called podagra. That's the definition of gout in the big toe joint. It's the most common area. The theory goes that once the uric acid gets away from the heart, which is the warmer core of the body, as it gets to the extremity, the uric acid is like freezing water. It starts to precipitate out. So it's kind of like as it gets cooler, the uric acid starts to precipitate out and it'll form into the joint.
How do you diagnose?
The diagnosis of it is X-ray, number one, clinical, like I said, really severe pain without trauma, but you can do it with blood tests. And you can actually test for uric acid. So we'll run 3 tests usually. We'll go uric acid, sed rate, and we'll also look at kidney function. Because a lot of times it's tied to kidney function too. Yes?
Is it more like, could some people have more genetic?
Oh yeah. Predisposed, yeah, oh yeah. Oh, definitely.
So, because I know a person gets it all the time.
Yes.
So it's something genetic within him.
It's something genetic within him. Touching on other causes. Okay, I was really just going dietary, protein, drink. But I was also another thing is the effects of cancer on somebody is that what will happen is if the cancer is breaking down your muscles, then you're getting a lot of uric acid into your system too. So that's another thing that you can't rule out, that you have to rule out as a cause. Here's touching on the diet area. That's just a very short cursory list. This is big, that's big, and then the liquor is also big with wine and cheeses too. So when patients come in and we give them a copy of the gout diet, they're like, okay, doc, well, what food can I eat? It really does cover everything.
Vegetables and fruits.
Yeah, it's like, that's about all you can do. One of the things, I also want to touch on, I don't think it's even in this slide, is the chemical causes for gout. And what do I mean by chemical? Drugs. And there are certain drugs that you take that they can bring on a gout attack too. One of them is being a diuretic, taking a diuretic. The diuretic can actually concentrate the blood. Symptoms of arthritis, there you go, we've touched on some of these. Swelling in one or more joints, recurring pain, redness, heat, limitation of motion, early morning stiffness, and skin changes. Right here, for gout, the blood test. Now, if we're talking about rheumatoid arthritis, psoriatic arthritis, then you have to test for the rheumatoid factors in the blood. So if we suspect psoriatic arthritis, rheumatoid, ankylosing spondylitis, these are tests that can have a blood test. You can test for the rheumatoid factor, and that will help you to further make the diagnosis. Osteoarthritis is definitely beat by an X-ray. Here is some of the treatments, and this is one that directly affects the foot. I want to touch on it. So if somebody comes in with gout, we put them on an anti-inflammatory. If somebody comes in with degenerative joint disease, we put them on an anti-inflammatory. But the main thing is trying to help the foot not move as much. Motion is what kills you. So if you've got bone-on-bone contact, the more you move it, the more it gets inflamed, the more it hurts. So you want to try and limit that motion. We try and do it with a good supportive shoe or with an orthotic. The prescription medication works a lot better than over the counter, but some people have certain functions that are that would limit the use of it. Kidney function, liver functions, those will help, or those will prevent us from using some of those medications. Surgery is a possibility if the toe is to the point where you can't even move it. There is joint implants for the feet, very similar to the joint implants for the knee, and they are very effective in helping to reduce your pain. Kind of redundant on that one. Here we go. By working with us, we can manage the arthritis. And like I said, one of the things we like to use is the orthotic. We love using cortisone injections if they're indicated. But most importantly, if we can, you can try and limit the symptoms. If they get too bad, you then eventually may have to succumb to doing some type of surgical intervention.
How often can you get an injection?
You get 3 a year into that same joint. So if you put it into the big toe, it's 3.
You can get 3 in each foot?
Yeah. Yeah. And you laugh, but I mean, I got a handful of patients, just nasty ankle arthritis, and they don't want any surgical intervention. They don't want anything done. So they'll come in every 4 or 5 months. We'll give them a cortisone shot. It lasts them a good 3 to 4 months, and they're happy with that. That's it. Any questions?
Cortisone,
Yes.
cortisone doesn't always work.
No, it doesn't.
I
No.
had cortisone shots done on my knees and that.
No, they don't always work.
Did absolutely nothing.
Correct. And that may be due to an indication of how advanced your arthritis was. I mean, what's going to stop bone on bone? It's not going to be the cortisone. It's just going to treat the symptoms.
It's gone.
Yeah, is it? Yeah.
Is that the
Is
only,
it? Good.
is that the only kind of injection you have?
No, actually, that's a good question. For the knees, they have other things called rooster comb injections. They also have Synvisc injections, hyaluronic acid injections. So they do try and replace some of that.
The feet is.
The feet, no.
Just cortisone.
None of it, yes, because none of that other stuff is indicated for the feet. They haven't indicated it for the smaller joints yet. Yes.
Don't laugh now.
No?
Could medical marijuana be used for? I told you not to laugh.
Anything that has a chronic pain component to it, yes.
Yeah.
Anything that has a chronic pain component. And, you know.
Where do I get my marijuana?
Yeah. I can't write for that, but I know some pain doctors that can. Anybody else? Yes.
You're saying 3 a year.
Okay.
Why? Is that, there's something wrong?
Yeah, you know.
It can affect your bones
Okay.
too.
When we were.
There's something wrong.
Yeah, because what happens is that I've seen slides after 14 injections where they didn't limit it. So what'll happen is it kind of starts to liquefy the tissue. Cortisone can actually make matters worse.
All of
So they determined that the perfect number is the rule of 3.
So, in your estimate, I know it's always with medicine. Is there a way to do it more natural?
Yeah, you
It's
can
how I like to do it. Like
supportive therapy, physical therapy can sometimes teach you muscles to use to try and offload some of those joints. So physical therapy has a hand in this. And there are some certain liquids that have an anti-inflammatory effect. There are certain holistic formulations that will help with inflammation as well.
What
Yes.
about the glucosamine?
Yeah, it does help. It does help.
Not just hyaluronic acid.
Right.
That's it.
That's right. That's right.
And then there's, because I've been trying to take the turmeric, and then there's the tart cherry.
There you go.
I take it and it works.
And the tart cherry juice is what a lot of people are pushing for gouty arthritis too.
It takes about a month, but it works.
Yeah, it works. It works.
Dark cherry?
Tart
cherry.
Yeah, and it has to be the original formula. I mean, it's like 20, 22 bucks, but it's the good stuff. You gotta take the good stuff.
How does that work?
It's a natural anti-inflammatory. It's just it's a natural anti-inflammatory.
Now, I just heard dark cherry juice and what else? Tart.
Tart,
Tart.
tart or black cherry,
I can't hear. What?
Turmeric.
turmeric,
Turmeric.
curcumin.
And they sell it in pill form.
It's gotta have curcumin in it too. Turmeric with curcumin.
Where do you get it?
I
Vitamin
You get it at
A.
GNC.
Yeah, you can get them at
GNC.
Google it.
At where?
Anywhere, any of the stores. Under.
Yep. Anybody else? Yes.
So we're talking about for pain. You can't take anti-inflammatories, you can't take anti-arthritic medications, then where do you go?
That's a good
Other
question.
than narcotic things, where do you go?
That's a very good question. That's one of the first thing that they do use is the narcotic. There are some narcotic-like drugs like tramadol and Ultram. Those are good too. Tylenol is, as you know, an analgesic, but it just doesn't rise to the, no, it just won't do it.
Doesn't really.
So you do have limited, you have limited resources with that. That's why an occasional cortisone shot always is helpful.
Well, because I have celiac disease.
Okay.
We're talking about autoimmune diseases and arthritis, and I think that goes with celiac.
It does, it absolutely does.
So I mean, because of celiac disease, I can't take any of those medications.
No. And so you definitely have to go to the pain guys. You have to go to the pain guys who can help you with that issue. And sure, and of course your rheumatologist, I mean, they're very versed at what kind of medications will help that won't offset that or upset your celiac disease. Because the anti-inflammatories can sometimes do that.
Yeah,
And you can't take them with that.
Thank you.
Yeah. Anybody else? Yes.
With the neuroma, what are neuromas?
All right, neuromas are arthritis. Neuromas are nerve, that's nerve tissue, okay? So neuromas, by definition, are an entrapped enlarged nerve. So that is something that can happen outside of arthritis. You don't have to have arthritis to have a neuroma, it can happen all by itself. Treatment for a neuroma is cortisone injections. Or take them out. Or take them out and remove them. You can see it on an ultrasound. Yes. You can see it on an ultrasound. Sometimes an MRI if they catch it right, but I prefer when I'm treating mine and they're not getting any better, I'll send them for an ultrasound, a diagnostic musculoskeletal
So
ultrasound.
where are you, Doctor?
Where are you at?
I'm in Lamont and I'm in Tinley Park. Lamont, yeah.
Is your
In
name?
Tinley on
Anderson?
167 Middle Park Avenue, right in the Ace Hardware store. Strip mall, yeah. This
I
one.
know she's giving you a
I am.
No, I'm not paying for it.
getting it.
Anybody else?
What? I got what?
Any other questions? Thank you. Thank you for coming. Yes.